Hi, everybody. If we can go move and take a seat, please. We'll be starting shortly. Okay, good evening, everybody. Hi, how's it going? Good. So, I'm sorry to interrupt your great discussions that you're having. There's some networking time at the end, but it's time to kick off tonight's proceedings. I see a lot of new faces. For those that don't know, let me introduce quickly SGInnovate. So SGInnovate is a deep tech investor and ecosystem builder. Deep tech covers a lot of different areas. I sit across medical and healthcare related technologies, okay? So we have about maybe 15 investments in the space. We're quite active. And we do two things. We invest really early. So we invest at pre-seed or seed. We're usually the first institutional money into startups. And we actively help build these startups as well, all right? So we're there in the trenches, shoulder to shoulder with the founders to get to these next milestones, to get to a Series A, to bring in those next group of investors. We're super passionate about digital health and the ability for technology to improve health outcomes and reduce cost as well. Increase value, reduce cost. So that's something really close to our heart. With that, I'd like to introduce Novi Health. Novi Health are a health tech and medical company founded by a group of clinicians and senior public health specialists here in Singapore. So with that, I'll pass over to JJ Lee, and she can kick off today.
All right, shall we take our seats? Great. Good evening, everyone. Thank you for taking time out of your busy day to join us for what will no doubt be an eye-opening discussion comparing the promise of digital health to its real-world value. So value in healthcare has always been a complex issue and a hotly debated issue, something that's always confused me, even as a healthcare communications expert. The way that I've always understood it is roughly that sweet spot between the quality of care and that certain price point to deliver it. But I'm sure that Sue-Ann or Ran or John or even Professor Chia would have very, very different definitions of value based on their experiences in the field. But when we start talking about value that advancements in digital health technology should be delivering to patients or health systems or even payors, that discussion becomes even more complicated. And so I think that it's very important that tonight we've brought together some of Singapore's leading minds in the public health, payer, employer, provider, and tech space to talk about digital health and have a bit of a checkup and ask, are we doing a really good job of using what's out there to speak to each other, to speak to patients, and where can we be doing a better job? So let's take a minute to meet our panelists. We'll start all the way at the end here with Prof. Chia and let him introduce himself.
So I'm Seng, just call me KS, don't need to call me Prof. Chia. And for those who are familiar with Singlish, just remember Kiang Su. So I'm trained as a medical doctor, but I'm afraid of looking at patients or seeing patients. So I decided not to see patients and move into public health. And my main interest is in terms of how do I translate research findings, especially in the academic setting, into policies and programs and the national level.
Hey everyone, my name is Ren, and My name is Suan. I'm a practicing doctor that specializes in metabolism, specifically certain conditions like diabetes, high blood pressure, etc. And I have been, throughout my career, very actively involved in clinical research. And everything I do, I would say, really stems from the problems and the issues and the challenges that I see my patients face. And I'm just, I think, out to try and find better solutions to address those needs. And that led me and some of my colleagues to start a startup called Novi Health, and that is essentially both a health tech company and an integrated medical practice, where from our experience dealing with complex conditions and complex chronic diseases, we know that it's not just understanding biology, it's not just drugs, it's complex behaviors, interactions between the individual and the environment, and there are complex issues such as healthcare financing that all need to come together to be able to adequately It's okay, I'll try and, okay. So we came together to really work on trying to deliver this more holistic solution. So we're all about adopting much more data-driven approaches to addressing the needs of our patients holistically, but not just patients, because we realize that we've been fighting the tip of the iceberg, and really we need to move much further upstream. So we don't just work with people already with chronic diseases, we also work with those at risk and actually those who are healthy. So in essence, our mission is to really change the course of chronic diseases, but empower everyone for healthier lives.
Hi, my name is Yichong. I'm from the Singapore Economic Development Board. It's the agency in Singapore that's responsible for charting the growth of the Singapore economy and developing all the industries that we see in Singapore today. The last 7 years or so, I've been mainly in investment promotion roles. Firstly, in Singapore, working with large multinational pharmaceutical and medical devices companies to get them to invest in Singapore, and then in Switzerland doing the same. More recently, in the last 18, 24 months or so, we've reorganized ourselves so that we give more space and resources to also look at emerging growth areas. And digital health is one of those big emerging industries. And I've been trying to look at that to try and nurture the growth of this industry.
And my name is John Gilman. I'm the head of health solutions for Fitbit, based here in Singapore. I'm an Australian who moved up here about 3 years ago. Fitbit, as many of you will know, created the wearable category about 12 years ago, and a couple of years ago started to expand into the healthcare space, which really is the intersection of wearables, data, personal insights and guidance, so behavioural nudges and human coaching to drive and sustain outcomes in health conditions. We work fairly closely with the Singapore government here. We're running currently a pilot program with them, which is integrating wearables into the population. It's called Healthy Insights Singapore. I love working in this country. I think the Singapore government, does some really extraordinary things, particularly in the healthcare space, and tremendous opportunities for us, as a wearable company. I look after 14 countries here out of Singapore and spend a lot of time on the road.
Great. So I think we have a very, very nice panel here tonight, so I'm excited to hear from them. Every day we hear about the promise of digital health technologies, and the investment, even in Singapore, in digital health is incredible. Some people say it's a very, very saturated market in terms of investment. And so I just want to start by setting the foundation and talking to our panelists about what is good for you when we talk about the promise of digital health technology. If we were to achieve our goal and get the outcomes that we desire, and we reached our targets, and we reached those blue skies, what would be good? What does it look like if we reached our promise? So let's start with Prof. Chia, or CK. As the founding dean, of one of the most prestigious public health schools in Singapore, and with your very, very extensive work in the public health sector, when we speak about the promise of digital health technology, what does good look like to you?
Well, thanks, JJ. You say we're the most prestigious school of public health. Actually, we're the best and the worst because there's only one school of public health in Singapore. You know? So I'm looking at things more from a population level, you know, rather than, say, from an individual level. Our healthcare system has been kind of evolved and developed primarily for acute diseases, in particular infectious diseases. And today we are actually faced with a totally different kind of epidemic, you know, something called chronic disease. That means no cure. You are going to live with it. And the best solution is prevention, as well as just being able to accept and manage your condition for as best as you can. So unlike infectious diseases whereby you actually have I would say a magic bullet, a vaccination, maybe antibiotics even, chronic diseases, you actually have no magic bullets at all. The key is changing behavior. And behavior is such a complex thing that there is not going to be a single magic solution. In my idealistic world, in my the naive mindset, I would say the magic bullet in chronic diseases is actually to change the value system of the population. Traditionally, we say that to change behavior, I give you knowledge. Knowledge will lead to the right attitude, and the right attitude will lead to the right practice, what we call KAP. We focus a lot on K, we focus a lot on P. One piece that has been missing is actually we never work on the A, right? And I think one of the key things that drives the A is actually a value system. And so to me, what is good is actually technology can actually help us to change the societal value system and therefore change that attitude. Singapore has been very successful because, to be perfectly honest, we value wealth and wealth. We won't admit that health is actually distant second. Right? We won't admit it. We say, yeah, of course, health is important, but wealth is the supreme. How do we change that to we value health just as much as wealth? I think it's not realistic to say that we value health more than wealth. But I think it's quite realistic to say that we want to achieve a state whereby the population value health just as much as wealth. And I firmly believe that today the technology will actually help us to achieve that.
And I'll turn over to you, John. John, how about you? When you are leveraging digital health at Fitbit, what is the gold standard here? What outcomes are you targeting?
So I think the principal outcome for Fitbit is really about driving change, sustainable change in healthcare. The interesting thing about Fitbit is it's a bit of technology. It's it's something that sits on your wrist that has a whole lot of sensors in it, and it does a whole lot of things. It tracks. I wake up in the morning now, and I can see exactly how well I slept last night. Not just the time I was asleep, but how much deep sleep I had. And Fitbit's moving in a direction where we can give you a sleep score, which is based on a whole bunch of different things. This device will track, has an SpO2 sensor, which means it tracks breathing disturbances. So in the morning now, I can see how my breathing was during the night, which is an indicator of whether I might have sleep apnea, but for me about revitalization, so how I feel in the morning. The thing about a device, any device that you have, if you're not going to use it and you're not going to get the benefit of the information that it gives you, then it's useless. It's going to end up in the drawer. I think the opportunity for Fitbit is really to help people understand the benefits of having that information. And again, it's not bombarding people with sort of a whole bunch of different metrics around every conceivable thing. It's packaging the information in a way that makes it personal and usable and actionable as well. Fitbit's whole ethos is basically providing personal guidance and insights to an individual to help them achieve their outcomes. The use of technology, machine learning is even changing how we do that. So in the next year, this device will take my data and will give me personalised insights and guidance that I then can act on. And I think that's that will be the inflection point. There are people who will always be motivated, to take outcomes based on the information they get. But if it's personalised and it's about me, it's about my health and fitness journey, then it's more than likely that people will drive the outcomes. So for us, the goal is really about helping people, to see the benefits of taking greater control of their health and fitness, with the information that we're able to give them as a company.
And John, I love what you say about if people aren't really empowered to use that data, then it will just be a device that sits in the drawer. I do have a Fitbit, and without the empowerment,
which is not on.
Sit in the drawer. Guilty.
Go home tonight and put it back on. That's okay.
I will put it back on. So then my next question then is for Sue-Ann. As a practitioner, as someone who is in the clinic and does the patient-facing hours, but then is also a health entrepreneur, you kind of sit on that intersection. Patients still want to see their doctors. They still want that human touch. And at the same time, they still need that health data. So when you think of what is good and what we are trying to do with digital health, what potential do you see for digital health?
Well, when it comes to what patients ask for, a lot of times they say, well, I have diabetes, that sounds terrible. Is there a cure for it? And when I first started my career, including doing research, it was really to trying to understand the underlying mechanisms, and all that's still important. The biology of what's happening is still important. But unlike cancer, for example, where we're getting better and smarter at understanding the molecular markers and the drivers, and that has real almost immediate, potential in more targeted chemotherapies, for example. Unfortunately, with something like diabetes and high blood pressure, etc., that are lifestyle-associated diseases, as KS mentioned, there is no magic drug or magic silver bullet. Unlike cancer, which may be 70% or more driven by the biology or the pathophysiology that's happening, for something like lifestyle diseases, it's the opposite. 70% of it is driven by behaviors. 30% is biology, right? So that is what I think led me to really not have a very typical career, in that I realized that we need to do so much more, and we need to go beyond our comfort zone. And I think that's where the value of new tools that we have in technology, including wearables, as what John had described, that can empower people with a better understanding of their own health. We are already seeing that. We have the 10,000 steps challenge. Despite the fact that JJ is not wearing hers, I'm sure a good number of you are still wearing yours. A number of us are wearing other watches that do track a lot of things. And there's an increase in this quantified self-movement, even amongst perhaps younger demographics. So it's happening already. So the question is, how can we then leverage and integrate the different touch points and data that is collected in a way that is meaningful, that can go back to benefit the individual, even if they don't know it or necessarily want to pay for it sometimes. And what I mean by that is, it's sometimes incredibly frustrating as a healthcare provider to say, we come with decades of credibility and clinical experience with certain advice, and they might not want to spend a single cent on that, but they'd much rather spend, on thousands of dollars on a aesthetic treatment or a spa treatment or a juice cleanse, right? So I think part of the gap that we need to fill is how do we pull together all the different touch points, wearable technology, understand the use cases really well so that we actually address those needs. And then I think, like it or not, as a doctor, we also have to know how to market that product better, because it's about getting products to individuals who will stand, or entities, employers otherwise, insurers, that will stand to benefit from it, but don't quite see it yet, are not willing to pay for it yet. How do we increase that awareness? And that's where I think we need to collectively define that value, change mindsets, and increase that awareness so that society as a whole shifts in that direction.
Thanks, Ran. And Ran, you really help employers take these concepts and scale this, right, for their employees, so reaching sort of a maximum population. So when you look at digital health technologies and you think about scaling this, what is exciting for you, or what outcomes are you looking for?
Well, to that question, I would say, it really depends on what insurers want, and we want premium, obviously. And we are not doing a very good job in terms of customer care. And I think that's the one key missing link where the technology and the third party can help us with. So if I may take one step back, try to share with you my opinion about, what does the insurance company want from this whole digital health wave and, technology. In my opinion, it would be boiling down to two things. The first thing is engagement, like everybody wants, and the second thing is a positive impact. So we all know that insurance company or insurance industry is a people business. After all, we are not selling any tangible goods. We are selling intangible goods that's building on trust and promise. And that can only be enhanced by, I would say, a constant positive customer experience, where I'm not just talking about the claims handling. I mean, how long time do you need to see your money back in your account? I'm talking more about lifestyle intervention, advices, and wellness programs. And the success of doing that, I would say, would pretty much determine whether an insurance company is successful in retaining the client, and also whether we can upsell them, and whether we can benefit from referrals. So this is the engagement part. I think digital health industry can really help insurance company to do a better job there. The second part is more likely from a medical insurance perspective and the positive impact. Different industry have a different impact definition. For us, I would say it's probably one of the three things: the good, the fast, and the cheap, right? So we are talking about either a fast and easy access to the care that people need, or we are talking about a quality information or effective intervention that helps to improve the risk profile of our end customers. Or lastly, if we can deliver everything cheaper, that would be nice. So in that sense, I would say the insurance company, at least from my experience, what do we look forward to partner with digital health players is we try to work with them, and we hope that they can help us to promote a constant positive engagement with our clientele, and in that process to deliver a positive impact on the risk profile of the client, and also to help them navigate through this sophisticated healthcare ecosystem to get the care faster and better. And lastly, if you can save some money from that process, that would be perfect.
Perfect. And before we go to Yicheng, I'd like to welcome our latest guest, Madeline Lowe. Madeline joins us from Prudential. She's the head of innovation for Prudential Assurance Company of Singapore. Madeline, do you agree with Ran and his assessment of what outcomes we're looking for in terms of digital health technology?
Yes, broadly I do. I will also start by saying that I'm wearing a Fitbit.
Okay.
And you'll be really happy to hear this. In the past couple of weeks, I bought 4 separate Fitbits for my parents as well as an auntie and uncle. Yeah,
Winning points with John.
Yeah. And I think that is a really good lead into what I really want to be sharing, is this whole digital wave thing. At the center of all of that, it's not technology. Technology is an enabler, but it's really real people, real lives. So why did I buy the Fitbits, right? It's because these are people I care about. Their health is something that they pay particular attention to at that age, and I just wanted to be sort of part of what they are concerned about, right? And it's no different from an insurer's point of view. For Prudential, we say that our purpose is innovating to help everyone live well, right? And so I agree with all that's been said, but front and center of it, it's the customer. There's a real life human out there. And everything that we do, the technologies that we bring in, but more than that as well, the community support that we pull in, and Fitbit's a great social tool, by the way. All of that, it's about empowering people to lead better lives. In Prudential, we have this campaign, a thought leadership thing that is going on. We call it Ready for 100. So last year, we went out and we asked Singaporeans, are you ready to live to 100? And 50% of people said, no, not really. Right? So we want to be starting conversations like this through digital means, and then leveraging the different digital tools at our disposal to help people along that journey. So it's a holistic thing. It's something integrated into our lives, our social lives, our work lives, our relationships, all of that. Right? I'm very happy to share also that later this year, we will be rolling out an app that's called Pulse. It will be made available free to all Singaporeans. And that app would contain things like a symptom checker. You can literally ask it, I have a headache. It will ask you a bunch of questions and then give you one of 6 answers. Should you be really worried? Maybe it's a stroke or something. Go to the hospital now. Or it could be that, hey, maybe a hangover, just go lie down, get some rest. So I think there are a lot of things going on, and as an insurer, we just want to be front and center of that as well, because that's where our customers are. It's all about life, it's about health, it's about people.
Okay, great. Thanks, Madeline. And Yichun, could you give us the 10,000-foot view then? From a very macro level, when you're looking at digital health technologies and you're looking at the systems and all of it and how it fits together, what outcomes are you looking for and hoping to drive towards?
Yeah, so from the vantage point of the EDB, I think in the end, the outcome that we're looking for is wealth rather than health, in trying to capture all the economic outcome that comes from this industry. But as Chia has mentioned or explained, the two are intricately entwined, and that's what we see every day in our job. The first, I think, realizing this, all these possibilities with digital health requires also the support of the government and policies to encourage that. And I know our role at EDB, one thing that we do is to try and work very closely with our colleagues at the Ministry of Health to connect them with some of the best companies and technologies around the world, be it in Singapore or elsewhere, and to ensure that we can find a way to try and adopt these technologies in the real world and assess that outcome. So I think John has been intricately involved in some of these discussions with HPP, etc. We do the same across with the hospitals and also other colleagues in the Ministry of Health. The second, and in doing this, in creating these collaboration opportunities and working with our colleagues to create the research infrastructure, the expertise, etc., we hope to catalyze a vibrant ecosystem of companies, both multinationals as well as homegrown enterprises. They are delivering products and services to enable the future of healthcare and creating the jobs that come along with that. And so that when people think about where do I want to innovate in healthcare in this world, they think about Singapore.
Okay, great. Thank you. So let's talk a bit now. Let's change gears. This is all good and well, but we do know that there are challenges to implementation. So when we talk about what are the gaps, what is stopping us from getting to this rosy and wonderful picture of perfect outcomes, let's talk about some of the issues and challenges that we encounter in our individual fields. Let's start with Sue-Ann. When we talk about consumer readiness, I alluded to the fact that tech moves at maybe 100 miles per hour or 1,000 miles per hour very, very quickly, while patients still prefer maybe the human touch or coming to see their doctors, or maybe they're not quite ready for the technology that's coming at them. When you look at the traditional care model and the digital space, do you think that there is a place for the two to work together to serve patients effectively, or do the two still stand at odds with each other?
No, absolutely. I think they absolutely need to come together because at the end of the day, technology is a tool. When it comes to managing chronic conditions, you talked about the human connection and relationship. I mean, it's because it's a long-term relationship, and you need to be able to trust and have a productive working relationship on both sides, because ultimately, as Madeline said, it's a real-life person that we are trying to help. They need to come together, and I think one of the key gaps today is that we've got an explosion of apps, we've got an explosion of different wearables and sensors, but what value can be derived from them really takes understanding the use cases really well, knowing who to light touch, heavy touch, knowing which pieces should come together for whom at what time. Also, it's not the same groupings will work for the same person all the time. The person also evolves over time, right? So that inherently is part of the complexity, but also where the opportunities are. So in what we do at Novi, we do believe in establishing trusting human relationships, because ironically, sometimes patients are not willing to do something that they know is logical. Human behaviors are not logical, right? That's logically good for themselves, but maybe because they've seen one of our health coaches and they know that, oh, you really do care for me, I feel a bit bad if I don't do it. They're actually paradoxically willing to do it for seemingly totally irrational reasons. But at the same time, we're all busy, and it's costly if you have to have these face-to-face interactions all the time. So that's where, in part, the use cases come in, where apps can can serve as communication platforms to enable better access. They serve as platforms that can integrate data from all these different touch points, be it wearables, with their consent, certain information that helps in clinical decision making, and then ultimately that feeds back to empower them with information and advice that they can use on a more real-time basis. That's how it might look like to the individual. Across the board, as providers, we are really expert at spotting patterns. That's what we're taught to do in medical school. But we are humans as well, right? It's probably a fact that when you see a doctor, they'll probably remember the last 10 to 15 patients that they saw. And when they try and spot patterns for you, yes, they have all that knowledge, but they tend to, retain certain things. Now, that's the power, potentially, of machine learning, right? When you're able to now systematically spot patterns, learn from them, and apply solutions back to benefit individuals and groups of individuals. That, in part, is how populations stand to benefit, entities stand to benefit, and that's how we can begin to realize value, not only for the individual, but for health systems. And when we talk about value, ultimately, it's outcomes over cost. The challenges in health and healthcare today is that we need to even come to some form of consensus as to what are meaningful outcomes. Because if you talk to the Ministry of Health, it may be around healthcare utilization from a payors perspective. It's how much claims, how can we, cost containment, cost reduction is a really lofty goal, but as a minimum cost containment. But to the individual is actually nice that my numbers look good or my blood pressure feels good, but if this medication or the advice you're giving me makes me feel lousy and terrible, That's no good to me. I can't function. I can't do the things that I value. I want to play with my grandchildren. That's what I value. So what are meaningful outcomes and to whom? And I think we need to systematically define that, and that is part of the data that we do collect on our platform to help aid that more data-driven approach to meaningful outcomes. Costs. We're terrible in healthcare at measuring costs, true costs. We really probably severely underestimate it. If you go and see a doctor today, what you see in your bill is probably the consultation and the drugs. But really, you know, in the public sector, for example, a lot of it is subsidized. There are a lot of costs that are not taken into consideration, right? And we don't yet have the discipline of tracking that appropriately. That's in part what we're doing to be able to really come up with appropriate, know where we are, and set certain benchmarks and define value propositions that are clear to each stakeholder involved.
Great. But can I ask a question that may be a bit controversial when it comes to providers, doctors, and digital health? I have been reading a bit about how doctors are suspicious, threatened even by digital health technologies, and they in themselves have become a barrier, not just the patients themselves. They do not want to adopt certain technologies. They do not want to recommend certain technologies. AI, for example, issues with patient privacy, or they feel that they may be replaced by certain technologies. What about that tension? Can anyone that works very closely with clinicians care to comment on that? Or is that too controversial a topic? KS.
Oh, okay.
Or Swee.
Yes. I guess, like I said, I think you know, change is always uncomfortable, right? And even amongst care providers, we're all humans. There's different generations of care providers. Even amongst the same generation, there are people with different comfort levels with technology and what that means. I think some of the traditional ways in which care is delivered and paid for is also a barrier, because traditionally it's fee for service. Paradoxically, the incentives are not appropriately aligned. A doctor or a care provider earns more money from having you come and see them face to face, having you take more drugs, do more tests, than if you went away and improved your lifestyle and got better and don't need to see them. Today also, a lot of these online interactions through apps, etc. I mean, it takes us a lot of time, right, to have to go through data that's sent back to us and provide advice, and there's no way to necessarily bill for that in today's fee-for-service model. Secondly, of course, the discomfort around liability, and medical legal responsibilities. I guess these are all valid, real concerns. How can they be addressed? I think in part, we talked about this trusting relationship. That's why it is important. Appropriate communication, the context by which things occur. You know, without going, I know we don't have a lot of time here, I don't want to hog up all the time, but for example, the context by which certain types of information are delivered and in what way, what language is used, what can be appropriately done on the app, whereas some things, no, you have to minimally pick up the phone, other things, you have to call them back. We try and avoid them, but sometimes you do. So that sort of judgment needs to come into play as well. I'm not sure if that answers your question, but I think it's inevitable. We just have to figure out how and embrace it.
I do like this rabbit hole that we're going down in terms of, is the system ready? We want to move towards a care delivery or a model where people are taking better care of themselves, moving towards prevention, taking care and charge of a greater wellness system, but we're still in a fee-for-service type of system. Can anyone comment on that? I'm kind of looking maybe towards Magdalene or Rand here. Have you seen any successful models in which these types of behaviors are incentivized and employers or payors can get behind this in a way that's at a systems level, it's more palatable?
Yeah, this is a really interesting question. And I think it's systemic, right? I mean, we are trying to shift from the fee-for-service model. It's sort of the only model we know here in Singapore. Very interestingly, just this morning, I was moderating another panel, and these folks from the United States, Kaiser Permanente, they introduced this concept of very holistic integrated care. So it's that whole value-based, right? You pay a fee, we take care of you till basically you get well. And in this system, people tend to stay on this for a slightly longer time. So then it makes a lot of economic sense to then try to get these people healthy or help them to maintain their health. So what they have done there in that model is they have managed to make the incentives align. We asked that question today's session earlier this morning, whether it's worth us taking all that trouble to shift there. And I think the sort of resounding answer from that, and that was a LIA meeting, so the Life Insurance Association of Singapore. I think the consensus view seemed to be that, yes, it's a lofty aspiration, right? Where you make a decision on whether to treat somebody based on whether it's the right thing to do, and not on, hey, maybe this drug's a little bit too expensive or whatever it is. And then the question is really how, right? And that's like literally the billion-dollar question. How do we move from there? And I don't think there are simple answers, right? It's really a question where it calls for interdisciplinary answer. So a lot of data points are needed, and that's why we're having this discussion here today on surfing the digital wave and so on. But it goes beyond technology as well. It's the economics of it, right? The Singapore Ministry of Health is talking about from healthcare to health, from quality to value, even something that's really not very digital, from hospitals to the community, right? It's when all these things come together, when we find coherent solutions for this, then I think we can start to say, well, let's start to make those shifts, small steps, small incremental steps. And what was particularly striking was the sharing also, that model that I described, they said they took 70 years to get there. All right, so if you go by the half-lives of things, maybe 35 years is a reasonable time for us to sort of fully make that transition. I don't know, speculation, right? But the future is ours to create, I guess.
I see. And KS, short of a huge system levels change, what other small interventions do you think could help in kind of bridging the gaps?
Yes, so my view is that financing is one of the biggest levers that needs to change. Conceptually, it is a no-brainer to say that we must move from the fee-for-service to one that is more a capitation-based kind of system. I mean, the theory is just common sense, let's put it that way. It's how do you make that transition? Should that transition be small steps? My personal view is that we shouldn't be evolving. And we have been trying to, especially when it comes to things that is kind of financial incentives, financial systems. If you don't make a hard reset, it actually will not work. You actually will cause a lot of unintended consequences. We fail to recognize that the complex system that we have is actually an adaptive system. That if you make small little changes here and there, people actually adapt. Both consumer as well as provider will adapt, and they will adapt in a way that, hey, I want the old style. So you introduce something new, I will still try and find my way around of how do I still stick to my old style. So I mean, MOH and I are not really in agreement on this. My view is that you actually need a hard reset when it comes to the financing system. But you need to have loads of courage, political courage, to be willing to say, I want to make a hard reset. Worse still, the governance of our healthcare system right now is in the form of 3 clusters. We are a country, this is closed door, so I can say all this. Anyway, I've stepped down as the dean, so I can be politically incorrect. So we are 1 country, 3 system. We're better than China. We're 1 country, 3 system, right? The 3 healthcare clusters are, in a sense, they can do what is right in their own eyes almost. They just have service agreement with the Ministry of Health and says, okay, I need to do this. But apart from that, they can do what they like, in a sense, right? And with that, yes, I think it encourages innovation. It encourages competition. So there are advantages. But it also increases complexity, and it also increases confusion. So one of the reasons why I think we are not ready for a lot of things, not just digital health, but lots of things, is there's just bloody confusion on the ground. There's confusion at governance level as well.
Very, very frank answer. In terms of systems level readiness, Ran, when you look at systems and the implementation of digital health, and you're going to your customers and really trying to get them to adopt certain technologies and get them off the ground and running, what challenges or barriers or pushback do you see the most in the region or in Singapore?
Well, I guess for the insurance companies, there are always 2 ways of doing things. One way is insurance companies try to do the innovation themselves, and they try to build up something and try to provide that service. It doesn't always work because large corporation has this mentality to kill innovation, and things are not running as fast as it should be, right? There are other ways of doing it, which is what basically Generali Global Health is doing. I cannot say it's successful right now, but it's definitely an alternative to do things. Is what we are trying to do is to become an aggregator, to house and deploy the new technologies or solutions and then push to the customers. So we all understand that nowadays the insurance industry doesn't really have a very good reputation. When people get a phone call from insurance, immediately they get alerted. Must be something wrong with my claims or any investigation that's involving me. If you're saying, hey, I'm giving you a call because you want to improve your house, people will start to guess, what's the underlying message there, right? That's why we think to bring in a third-party provider to help us to do that part will be actually easier to get to our client. So I'll give you a few examples. Many of you here must have heard about the teleconsultation, right? The teleconsultation with the GP, which is right now rather popular in Singapore as well. And currently, our company has been providing that service through a vendor to the end customers, unlimited to all our customers. Because of the nature of our clientele, who is globally mobile, they travel all the time to different countries, they would have a peace of mind wherever they are in the world to have the access to the quality care they prefer to have at the fingertip. And the other one is, I want to give you an example is the genomic profiling for the cancer disease. So that's a DNA sequencing analysis service provided again by a third party. And they help the treating physician to understand the tolerance or acceptance of the certain patients towards a certain cancer drugs. Eventually when that's delivered, the physician will understand better about the direction of the patients. They can choose the right drugs to use, and eventually that would increase the efficiency for the whole treatment segment, and also lessen the pain or potential pain experience for the customers. Those are the two things we are currently already implementing through the third vendors, and we are packaging everything into our portal so people have easy access. But then when they access to it, they understand it's something insurance company has paid for, but it's independent services. So they have less concern about, what about my privacy? What about my new renewability next year if I have a cancer this year? I have asked several of my friends about this, how much you know about this kind of services. And unfortunately, not many of them knows about a genomic profiling, especially for cancer. And that's a huge shame that people don't know that. But even if they know that, I guess it's hard for them to know which one is the best provider in the world to help them with. Teleconsultation, many of us in Singapore have known it, and several of us have used it. But it seems to me it's rather hard to convince them to pay for themselves for a package for a year or fee for service. So I guess that's why I believe an insurer is actually in a position to work together with the digital health providers to offer this kind of solutions, because we are in the field, we understand the market and the solutions, and we have the economic of scales. And that's the ideal way to go into it. But talking about the challenges, I guess one of the key challenges is of course the ROI. But I don't want to talk too much about that. I mean, it has been heavily discussed. From insurer's perspective, the challenge in deploying a new technology is actually about agility. We are very traditional industry players, and it takes a long time for us to adapt a new technology and put that in use. That involves the marketing, the communication to the client, and eventually, if it doesn't really bring to the value that we wanted to bring, are we agile enough to switch that off and change it to another provider? So that's the main challenge we're facing right now. There has been enough technologies, and there are good ones, they're excellent ones, and there are less suitable ones, I have to say. So for insurers itself, I would say being agile in terms of facing those changes would be key.
Yeah. That's very, very insightful. I like that you brought up ROI, though, and I don't think that we can get away from the ROI question, because this is something that we all don't want to discuss, but we all can't get away from, which is measuring the value. As people in the digital health field, how do we actually measure the impact or the value of digital health? Perhaps I can turn over to John on this one. When we look at data, and we look at longitudinal data or even short-term data, we look at the health of a population, and we look at measurement and ROI. How do you look at ROI and measurement?
So look, fundamentally, as an organisation, we know that we can drive and sustain behaviour change. And it goes back to what I was talking about before. You give someone the technology, and you give them the data, and you give them the insights, and if people are motivated, they will achieve an outcome. We did a data hackathon in Singapore in September last year. Basically, our data science team in San Francisco downed tools for 2 days, and they looked at all of the data that we had collected in Singapore, all the anonymised data we'd collected in Singapore in 7 or 8 years. And that on its own is probably the single biggest health and fitness database in Singapore. We know that we have probably more data than most other companies. What we were able to ascertain, and the insights were really interesting. We looked at a whole range of different people across different age groups, and we were able to determine that say someone who bought a Fitbit. We looked at their activity in the first month, and then we looked at their activity a year later. Our least active customers in Singapore, so these are people when they bought a Fitbit, Like my mother, who's 80-something and has a Fitbit, she was doing 2,000 to 3,000 steps in her first month. The average Singaporean was probably doing that much as well. A year later, we know that these people were doing between 10 and 13,000 steps. So, just the simple act of strapping on a device and walking and watching and seeing the benefit and maybe losing some weight was driving a clear outcome. So as an organisation, we fundamentally know that we can demonstrate a health or a wellness ROI. Globally, we work with a lot of companies that integrate, particularly insurance companies, and a lot of corporations that integrate devices into corporate wellness programs or into customer programs. We currently have probably around 6.8 million people around the world on either a company or an insurance program. We know that insurers in particular, with due respect, don't spend money unless they're going to see a measurable outcome. And we are seeing, really extraordinary outcomes. We work with a company in the US, one of the largest insurers. They have a program, which is a company-structured program for their customers. It's called the FIT program, and it stands for Frequency, Intensity, Tenacity. The insurance model is a bit different in America. It's employer paid. What that company has tried to do is to motivate its customers to walk more, be more active and sleep better, and if they do, they will see a reduction in the premium that they pay the company. So if I'm a United Healthcare customer, I can earn up to $1,500 a year, so that's cash off my insurance premium, which is a direct saving to me. The last time I checked, the company had paid out about $25 million, so it was an incentive for individuals and the companies to drive a health outcome. So we know as a company that we can drive and sustain change, and that's the most important thing. People need to feel comfortable with it. They need to, not everyone who's going to put on a Fitbit is going to want to do that. But if we can deliver measurable change, measurable outcomes, it makes a huge difference, both for the individual and the employer or the insurance company. And that's the key thing. No one wants to invest unless they're going to see an outcome. And that's the most important point here.
Great. So, in light of that, we hear a lot about data overload. We hear a lot about the sea or the deluge of wearables and devices and all the great technologies that are out there. Madeline, Ran, Suan, when you're looking at all of the devices and availability of technology out there, how do you navigate that? Are you completely agnostic when it comes to the type of technology that you use or you curate? How do you actually deal with that? Can you speak a bit to that? We'll start with Suan. And move down the line.
So we are agnostic. We come from the perspective of use case, understanding the use cases really well, and then we curate and integrate whatever is the best possible for that use case or the user. To give you a specific example, in diabetes care, we now have continuous glucose monitoring devices that do not involve you having to do a painful finger prick, sticking it in to measure your glucose. It's a patch, you wear it, and it can continuously measure your glucose in real time, plot out graphs. And the importance of that is that by looking at the profiles and seeing how your body responds to certain foods, physical activities, sleep, mood, medications, if you're on it, you are then in a position to gain actionable insights in real time. You're then also empowering your provider to give you much more focused advice that's tailored to your needs. Now, there are many different such devices in the market. I wish there were more, but I think in Singapore currently we have 2. Globally, there's at least 3 or 4 providers. Our job is to understand the strengths and limitations of these different offerings and put forward the best. So for example, for the user who is just trying to better understand lifestyle, but they don't yet have disease, they don't need a super high level of precision, we may recommend a certain company's device. For another, if you're pregnant, if you're a type 1 diabetic who needs precision or accuracy to dose your insulin, I might recommend a different device. There are trade-offs. Another device may be more expensive, may still require you to calibrate with at least 1 to 2 finger pricks a day. So these are trade-offs that may make sense if you need that particular use case. So that's one specific example. I think at the end of the day, as we evaluate this and what we do, we hold ourselves also to outcomes that I talked about that are meaningful, right? So simplistically, it's the A's to the F's. And I mentioned to you earlier, while we started off from those with diseases, we realized then to solve that really sustainably, we need to go much further upstream. So remember, it's diseases, at risk, and healthy. So the A to F's really cover that spectrum. A, aging, preventing aging. How do you measure that? Well, to prevent aging, you need to stay active, another A. Active in body and mind. The apps can track. So we have different functions, for example, and we measure user engagement on these different screens. Are they tracking food more? Are they tracking sleep? What are they tracking? If what's happening? If we are delivering certain content, do they seem to like videos more, or do they like infographics? Do they like long-form articles, or does that differ depending on the type of advice that they are looking for? So these are things that one can track and measure. B for blood pressure, C for cholesterol, D for diabetes, E for excess weight, because obesity or even being overweight, as some of you may or may not know, the cutoffs are different by BMI, and BMI is a relatively crude indicator, so we use the term excess weight. You can be putting fat in the wrong place, for example. And fatty liver, which is tremendously common, right? So actually, all of us here would probably fit in one of the categories regardless. Now, fortunately, for all of these, there are objective measurable outcomes, some of which are pretty well established. So for example, blood pressure, that's measurable. Diabetes, that's traditionally a blood test. HbA1c, that measures your average glucose for the last 2 to 3 months. That's known, that is used. We have studies that say, okay, if you reduce your A1c by 1%, in what type of populations, what kind of cost effectiveness can you derive from that? That's known. But we are also venturing into the unknown. For example, when we look at ambulatory glucose profiles, right? What do these different patterns actually mean? There's new parameters like time in range. If we know that a normal blood glucose is between 4 to 8, your average may be one number, but does it matter what percentage of time you spend in range? What do the peaks and the troughs mean? These are all still relatively ill understood. And from some of the work that we're doing, we're also hoping to shed light on that so that the outcomes that we measure become increasingly more meaningful and useful as well.
And do you agree with that, Ran?
Yeah, I totally agree. I couldn't say it better, basically.
Yeah, I mean, agree as well. I think I'll add also that in spite of all the progress we have made in terms of measuring data and sort of understanding all these different health indicators, I think we are still some ways away from really being able to use that in insurance actuarial calculations.
Yes.
Right? So, just as an example, we know with very, very good precision, if you are 5 years older than you are now, what that means for your mortality, what that means for your certain risks, right, that we are insuring you for. We know with a great degree of certainty that if you're a smoker versus a non-smoker, right, and we are prepared to price that down to the cent, and that's standard insurance, right? Nobody that I know of, at least in Asia, is able to say, look, if you conscientiously walk your 10,000 steps every day, how much less can we charge you? Sure, there are schemes out there, but I think they are probably using their marketing dollars for that rather than for actual calculations. So that is the gap that I think we are seeing. I think the gap will close as we sort of put in more research into it, as we and by research, right, I mean the really like scientifically validated stuff that comes out of universities, not just sort of what companies do in terms of your headlines, right? So there is a lot more work to be done, but I think we will get there, and the digital wave will sort of help us speed up the pace of getting there.
So to ask a cynical question, do you think that all of this digital technology and data is actually causing patients and consumers to be more engaged and more empowered? Or do you think that all of this data is causing patients to actually be less engaged and more overwhelmed? What do you think? Ishan.
Well, I was actually thinking about a clinician that I spoke to, and one clinician said, I don't want more data. And I think it's the same for consumers. Consumers don't want data in and of itself. And I think just reflecting on what everyone has been sharing so far, technology is not the bottleneck. Data is also not going to be the bottleneck. The bottleneck is going to be adoption, and adoption is linked intricately to value and intricately to needs. At the end of it, you have to realize, who are you selling to? Are you selling to the consumer? In Indonesia, for example, we talk about telemedicine. Halodoc was one of the earliest movers, but their offering to consumer was, yes, a telemedicine platform, in fact, at very low cost, but the real value to the consumer at the end of it was, I could get my medicines within the day, within 3 hours, right? And that was what really drove the adoption of the business. And I think similarly for all other consumer-oriented companies, how do you create a stack of service that will actually get the consumers sticky and onto your platform? I think a big challenge with health and wellness is that ultimately it's not a high-frequency service that you use. So how can you create a whole stack so that consumers will come back to you and use that? And I would say the same thing for clinical, in the clinical space of things. How do you empower clinicians? I think one thing, if I'm speaking maybe out of hand here, but I think one thing that clinicians don't have is time. How do you help them make decisions faster, more easily, clinical decision support, etc.? How do you ensure that they have their liabilities that they're worried about, that those are covered? Picking out the topic of genomic testing and genetic testing, the use cases are immense. And here, in Singapore, we're not so far ahead, but let's say in the US, it's taken off. But even though those use cases exist, clinical adoption has been difficult. We went to Rady's Children's Hospital, and they're using genetic testing for infants in the NICU. So it costs $4,000 to $5,000 a night. They have had cases where, because of this genetic sequencing, they were able to make a diagnosis, change the care plan, and infants who've been in the ICU for weeks are now able to go home. But you would imagine that such a use case would draw a strong adoption. But adoption remains difficult because on the clinical side of things, not everyone understands the technology. Not all doctors understand that. Not all hospital systems are willing to push for that. And the cost effectiveness isn't easy to prove. And so in the end, it comes back to needs, it comes back to values. And I think for us, we can't aim or hope to change the entire system. I think we can only look for the strongest use case, the strongest needs, start from there, build from there.
Great. So we're nearing the end of our session, so I want to close by asking a very pointed question. I don't like when these panels end with everyone saying we need to conclude by all holding hands and saying kumbaya, and we all need to build better relationships with each other. So I want each panelist to answer, if in the next year you need to sharpen your pencil and really reach out and build a better relationship with one person to strengthen the digital health relationship. So do you need to build a better relationship with patients, with providers, with the government? Who is it that you, in your capacity, do you need to reach out and build a better relationship with? I know it's hard to choose just one. I know we want to choose everyone and get along with the whole room, but who do you think that you really need to build a better relationship with? Tough question. John, I'll start with you. Okay.
I would say probably for us, it's the medical profession. And a lot of what I've heard tonight really reinforces that. Every doctor will know that being more active, eating better, sleeping better, deals with a whole range of health issues. If people are more active, their risk of diabetes type 2 goes down. If they're more active, their risk of hypertension goes down. I think picking up your point about doctors being time poor, I think for me that would be the focus of what I would want to do over the next 12 months is to help sort of probably connect the dots for doctors that, if people are more active, if you're measuring it, if you can see it and they can understand the improvement, that's going to drive, I think, massive improvements in the sort of the chain for a company like Fitbit.
Great. Okay, sure.
I think for us at EDB, I think we ride a nexus between companies as well. And I think I like to say that because companies in digital health are trying to change the system, there's not going to be one single winning company. There's going to be winning ecosystems of companies. And I think we will try and play that role to try and facilitate and create the right infrastructure for companies to connect to one another to deliver the stack of value of services.
I'd say employers. The employment to population ratio all over the world ranges from 60 to 75%. So that covers 2/3 of the population, save for Middle East and Africa where it's lower, right? And the working adults also are windows into others, children in their families, and the more senior population who are not working. So if they have healthier habits, it will also have knock-on effects on the rest. The key gap also, I talked about marketing. People are not willing to pay for some of these preventive services and solutions, but if their employer pays for it through the flex ban and whatever other leverages exist, then we actually have a fighting chance of getting them towards certain solutions that may actually benefit them and their loved ones.
Well, if I have to choose one, I would say it's probably between the insurers and providers, medical providers, hospitals, clinics, and physicians. It's mainly because the everyday challenge we're facing when we talk to corporate clients, employer groups, is cost containment, is sustainability of the rates. And from what I can see, there's still quite a lot of room to improve in terms of cost containment, cost saving, and efficiency between the insurers and the providers. And in fact, we already see quite a lot of progress for the past few years with the blockchain technology. Companies try to link insurers, payers, insured person, and providers to share the data with each individual has their own preference of how much data they want to get exposed to, and that's transferred securely. So I think that's one important steps goes towards a cost saving or more transparency for people to share the information and to make the right decisions. And also, like just mentioned, in America there was this whole accountable care organization involvement, and for the past 5 years, I think we have seen quite a lot of success of that, and it's all backed by the data analytics. Whether such data point exists in 5 years, 5 years ago, I don't think so. And that's the whole wave moving into that insurer or payer, employer, and provider relationship. And I think that will be the critical point I want to address in the coming year.
For me, I would say bringing academic input into the medtech kind of companies, the private sector. The way I see it is that a lot of times the vision that an individual company has is actually fairly narrow, fairly limited, and the ability to evaluate, for example, the potential impact and all that, it's fairly circumscribed. So I think there is lots of actually academic input that can go into the private sector. The traditional model is one whereby you do your research and then after that you spin off. But I think moving forward, it should be actually working hand in hand. And I think that should be the next step.
Thank you. So Prudential works across the spectrum with sort of other insurers even, definitely the wearables people, IoT. We have had EDV in our office just very recently. But I would echo what Kay has just said, actually. I think the thing that would shift the needle the most for us as insurers is if there is an evidence-based way of saying, if you do this, then this. So yeah, I look forward to more collaboration with the academics of the world.
Great. So you heard the panelist wish list for networking. Please find your appropriate panelist. I'm kidding. I'm going to turn it over now for any questions from the audience. We'll take any questions that you may have in this session. Do we have a microphone? Yeah.
Digital solutions are kind of like lawyers. You know what that's lawyers mean? Like they say, I give you advice, but you or your doctor will have to make the decision and the changes, right? So I feel it unfairly puts liabilities and the physicians in the position of cognitive, right? Because how, you know, if it's a physician support tool, and you know, so is that going to change? How do the physicians feel about it?
Does anybody want to take that question?
Position.
Right to Swee.
I feel like I'm in the hot seat. That's true, and I think that's one of the reasons why there are real challenges to adoption, right? I think what we come from is the vantage point of being a clinician and being a provider and understanding where we really wanted to make use of certain tools and technologies to help our patients, but for various reasons, it works both ways too. Like sometimes I think prior to this, I think all three of us, the co-founders, didn't start off any point in my career thinking, oh, we're going to launch a startup together. Far from it. I mean, it's really seemingly the most bizarre thing to do at this point in our careers. But it really stemmed from, there were these needs. There were multiple tools and potential tools, and we said, could we tweak it to do this, please? This is not going to work like this, and you have to, you know, and there was some willingness, but sometimes just lots of barriers, time being one of them. Like, you know, we're speaking English, but can't get it. And then if we believe in it and we try to champion it amongst our organization to drive adoption, we also face certain challenges. How we overcome that is to work with the coalition of the willing, demonstrate outcomes, do it rigorously, and then drive more adoption. So there are success stories, and I think we have to learn from these success stories. We also have to learn from the failures and what could be done differently, perhaps, right? So coming back, I think that tension is real. That's why I think we need to have platforms. This is a small start, where we at least bring different stakeholders together to have that conversation and see each other's vantage point and to solve this problem together by understanding these pain points and really figuring out how to work through them together.
I think maybe just to add, doctors have to change. Patients and consumers also have to change. Doctors have been trained to behave like God. Patients have been conditioned to worship the doctor. Right? The positive thing is that I think with successive generations, the younger generations now beginning to appreciate more and more that things are within their control, things are within their hands. Right? And they are willing now increasingly to take responsibility. Not just for social issues and so forth, but yeah, I think increasingly taking responsibilities even for their own health, and to become less and less dependent on the medical profession or the doctors. So I think that's actually, I'm actually optimistic. Right? My generation will just die off, will fade, you know. But the younger generation, those below 30, it's a totally new world, a totally different way of seeing things, a totally different way of taking on responsibilities.
in the hot seat again. The short answer is yes, but not because I'm a doctor. No, truthfully, I think medicine is a science and an art, right? And technology and AI, they are tools. I think AI has a place in improving efficiencies. AI has a place even in improving efficacy. When I talked about the example of spotting patterns across populations, for example. But at the end of the day, right, if you had a simple condition like a rash or a cough or cold, whatever, you may be perfectly happy to do Dr. Google. But if you're really worried about something long term, and that's why I think a lot of apps that just have chatbots or even health coaches behind it, but it's just sort of delivering very cookie cutter advice, don't quite cut it. So I think there will always be a role for doctors, but the role will likely change over time. And to be fair to doctors, I'm not trying to defend the profession as well, but when I went to medical school, we learned so much. To be fair to the next generation, what they are learning in medical school is so different too. But it's also sad sometimes because I think some of that communication and that blending of that science and art down to the bare basics, some trade-offs have been made. But then this new generation of doctors has to know how to deal with technology, look at ambulatory glucose profiles, which is something we never had when we went to medical school. But that's going to evolve. Yeah.
Good question.
Maybe I can add to that as well. I think at EDB we think about this because it's about the future of jobs and future that we're trying to create in Singapore as well. I think firstly, I think the technology today is progressing very rapidly and it's great, but if you look at IBM Watson's or IBM Health's collapse in the US, I think you figure out that maybe we're still some years away. No doubt we'll get there, but I think we're still some years away in terms of diagnosing some very complicated diseases, especially in specialty care. I personally I share Suen's optimism as well that clinicians will continue to remain to exist and have a very important role. They perhaps will have more time to spend with people, and I think then the human touch would perhaps be enhanced in clinical care. I think we're also seeing that there are roles like genetic counselors that could come, behavioral scientists, health coaches as well, because a lot about improving your health and your wellness is about the human touch. I think that there will always be a role for humans, and it's not going to be just technology doing the show.
Hi, as a consumer on the street, what do I care about? 21st century digital wave, healthcare or something. What do I care about? I care about three things. Number one is information. Information about my past history, health record. Information about what likely I will face, what the health problem I will likely face in the future. These are the information I need. The second thing is, that I can make an informed decision based on the information I have. And third thing is, what action can I take? Hopefully the cost will be effective in an effective manner and all that. So the question I have is, based on my needs, currently is Singapore, do we have an ecosystem currently to capture all these needs of men on the street like me? Okay, one of the missing link I think is the MediSave, which most Singaporeans use to subsidize our healthcare expenses and all that. Is MediSave part of this whole system or ecosystem? I'm not sure. I don't know. Would it be part of this whole ecosystem as well? So my question mainly from the man on the street's point of view, how could I benefit from this whole thing, and is the ecosystem ready for us?
I'll have it. It's interesting, as a company. So I've been spending a lot of time looking at the health industry over the last couple of years, and just a couple of observations. Basically, people are becoming less healthy, or people are getting older, and the cost of providing healthcare is going up. And we have to do two things. We have to help people. Take greater control of their health, so we arrest the decline of or the advance of chronic conditions, and fundamentally we have to bring down the cost of providing healthcare, because it's not sustainable. No country can continue to keep throwing money at the problem, which is typically what has happened in the healthcare industry. At the same time, in the last 10 years, there's just been this tsunami of technology. And it's difficult. If you're a consumer, it is extremely difficult to know which way to go, which way to turn. I'm a good case. I've lived in several countries and I've got doctors in lots of different countries. And, if I go to a doctor here, I don't have my health records from Australia, I don't have my health records from America. And, I can't remember the last time I had, say a tetanus shot or something like that. It is inevitable that technology will coalesce and life will become easier. But there's also the risk that it's going to get harder, and the promise with technology is that it would make our lives easier. I'm old enough to remember the days before mobile phones. I grew up with 5 sisters, and if you wanted to make a phone call, you had to stand in the queue and wait for the phone to become available. What we now have is a situation where there is so much technology. There are so many apps. There are so many solutions. There are so many platforms. There are so many, wearables in the market. And if you're just, ordinary individual, trying to live your life, it is really difficult. But I think there is hope. I think there'll be, and I can see this sitting at Fitbit, there is a coming together. And, you probably live in the best country in the world for that coming together to happen, because the government here is really focused on delivering integrated solutions for the population, for the right reasons, but fundamentally to stop people getting unhealthier and to bring down the cost of providing healthcare. And some of the initiatives here, like there's a program called Smart Nation, which is really the envy of a lot of countries around the world, and the Singapore government will deliver outcomes. In a few years, you will have probably a complete medical record that is your entire history. It'll be done obviously with the right privacy protections. If you're wearing a Fitbit, or another device, your doctor will have access to all of that information in an easily accessible way. I think the way the industry is at the moment, we're just sort of riding this huge wave, and it'll settle down. There'll be integration. There'll be changes. You'll be understanding the value of the technology and what it can do for you. Today, if I want to interact with the Singapore government, I need to use at least 6 or 7 different apps. If I want to go to a gym, or if I want to go to the doctor, or if I want to, it's not easy. And that is what's driving. The user experience, to a degree, is what is driving the change and the improvement. So not great today, getting better, but it will change and it will come together, I think, in the next couple of years. And this is the country where it really will happen. We're doing some work with the government, and we're already being contacted by other countries that look at what Fitbit is doing with Singapore, looking at how they can pick up and adopt solutions in their markets. It's a good place to kind of ask that question and to expect a solution probably before too long.
So on that note, we are out of time officially, but our sponsors have provided food and drink. So if you have any lingering questions, please do join us. We have the place for another hour or so. So please do join us for food and drink and ask any remaining questions you have to our panelists. Thank you so much for joining.